Okay, we're continuing with the book here. Prevent and Reverse Atrial Fibrillation and Congestive Heart Failure, Afib and CHF by me, Pete Rogers. We're on page 59 if you're following in the book. We're going through drug-induced atrial fibrillation. These are drugs associated with increased risk of AFib. Anti-migraine drugs like sumatriptan, cholinergic drugs from the excess vagal stimulation, acetylcholine, physostigmine, donazepam. Diuretics, they can lead to hypokalemia, low potassium, hypomagnesia, low magnesium, and can cause other electrolyte abnormalities. So some of your classic diuretics that can do it include the hydrochlorothiazide, thiazides, proton pump inhibitors will decrease magnesium absorption in the gut. That can lead to AFib. Drugs with complex or multifactorial mechanisms, corticosteroids, they got a mineralocorticoid effect. That's related to hypertension, sodium conserving. Hyperlipidemia, hyperglycemia, dexamethasone, these corticosteroids, methylprednisolone, anabolic steroids have increased risk of drug-induced AFib in bodybuilders. It's also increased with the age of the patient. Bodybuilders tend to take much higher doses of anabolics. Okay. Low testosterone levels. Well, that's just aging. All right. Chemotherapy drugs are associated with increased risk of AFib. A lot of them, a whole bunch of them. Just think chemo in general. And people aren't just on chemo for cancer. A lot of people are on chemo for immunosuppression, for autoimmune disease like azathioprine, for example. This is one of the papers here. And here's a whole bunch more of them. Look at it. There's tons. Just in general, when you think of a chemo drug, think of it increasing the risk of AFib. There's tons of them that are associated with AFib. What I got there? I got over 35, 36, 42, 43, 54 chemo drugs associated with AFib. And you know what? I'll bet you there's a whole bunch more. I just didn't have time to include them all. So in general, anything that's going to be used to treat chemo is going to increase the risk of AFib. You can think of that as being a reasonable assumption. Okay, I'll leave it at that for today as we continue on these things that can cause AFib. Hope you find it helpful.